Our second guest today is Stephanie McLeod, Chief Nursing Officer at Novant Health Brunswick Medical Center. Well, welcome back to the show, Stephanie. I know you've been here before, and it's a pleasure to have you back today. And I understand we're going to talk about something new and exciting at Novant Health Brunswick. But before we do that, let's reintroduce you and tell us what you do at Novant Health.
Okay, thanks, June, for having me again. I'm Stephanie McLeod, and I'm the Senior Director of Patient Care Services and the Chief Nursing Officer at Novant Health Brunswick. And I'm here today to talk about the new patient education channel.
Well, good. Tell me a little bit about your role. I know you said you're the Chief Nursing Officer and you're Senior Director of
Patient Care Services.
And what does that mean, Stephanie?
That actually means I'm over a lot of services that are involved in taking care of patients, such as all of nursing, and then also pharmacy services, which deliver medications to our patients.
Correct.
Physical therapy, which gives services, respiratory therapy, and surgical services. So anywhere you see a nurse, generally I would be over that department.
I see.
And including a few others.
You are a busy lady.
Yes, I am busy, but I enjoy it.
I'm sure. How long have you been at Novant Health Brunswick Medical Center?
This is going on my 6th year.
Wow.
Yeah. Time flies, doesn't
it? Time flies.
I know.
Seems like you just came.
I know. It does.
Well, we're here today to talk about the new patient education channel and the newborn channel that were recently implemented at Novant Health Brunswick Medical Center. So tell me, what is the purpose of this new patient care channel?
It is an additional resource, educational resource for our patients and their families. It is going to be in every patient room, and it's on the television. It's channels 74 and 75. And whenever a patient turns on the television in their room, it automatically comes up on the patient education channel. So we have a variety of topics. The patient education channel is going to be more for our regular floors in the hospital, and then we also have a newborn education channel. So we're very, very excited about this. It's been proven that, most people love to watch television.
Sure they do.
And you can capture their attention.
Absolutely.
And
we love when they watch HealthWatch.
We certainly do. So this is just another way that they can learn about the many topics surrounding either their disease process or their condition that they were admitted to the hospital for. And so we're very excited. And it also gives the patient a voice and choice in their own care. So, you know, they can choose what they want to see on the television, and it makes it easy for them as well.
Well, that's real interesting. So it's sort of part of their care. It's sort of part of their treatment plan.
It's an integral part of their care. There are several topics on there, as I mentioned before. Let me give you an example of some.
Sure.
Diabetes, heart failure. Let's see, what are some others? On the newborn channel.
Let's talk about that newborn channel. I'm real interested in that. What does the newborn channel, what's the purpose of that?
The purpose of the newborn channel is to educate the mother and be an additional resource for her, both in the hospital after the birth of the baby and also when she goes home. And one good thing about this is that the patient with a code can access through their computer system at home the newborn channel as well. So even if they've watched some of the topics like how to care for your baby's umbilical cord.
Really?
Oh yeah. You know, how to bathe your baby. Some things to look for with the new baby.
Like before you call the doctor?
Right, absolutely. How
about breastfeeding?
Breastfeeding as well, yes. Although with breastfeeding, we also give information while the mother is at the hospital.
Sure.
And they also have the opportunity to call back to the hospital to get additional help if they need it. But that is a topic that is covered there as well.
So really this is an additional source of information or education for the patients and the families.
Absolutely.
Correct?
Absolutely. To learn about their actual disease process, or either their diagnosis that they were admitted to the hospital. And it has been proven that the more you know about your own problem, you'll have better patient outcomes. It also can help the patient to have fewer admissions and readmissions for the same problem. So it talks about being compliant with your medications and also some of the symptoms to look for in the disease process. And so it's going to be a very big help to our patients and their families, but not only them, for the physicians,
well, I was
nurses,
going to ask you about that.
and the staff.
How will the physicians or nurses utilize the patient channel or the newborn channel?
The physicians have, this was approved by our physician staff,
Right.
and they have looked at the different diagnoses and disease processes and topics that the channels offer. So they're familiar with that, as well as the nurses and the rest of the staff, not only nurses, but respiratory therapists, physical therapists.
So all the departments are real familiar with this.
Anybody can offer, the patient education to a patient or their family.
So if I were a patient and my physician wanted me to watch a particular segment, he would let the nurses know that that's what I need to do, or let somebody know that I would need to watch this, and then that's how that would happen?
Absolutely. The physician may write an order even for the nurse to say, please have the patient watch the diagnosis of diabetes. If it was a newly diagnosed diabetic, he may ask the nurse to make sure that the patient watches that particular topic. Or he may just verbally tell the nurse, I think it would be good for the patient to watch so-and-so. So many ways. And then the nurse or the staff can, as they are talking with the patient, and maybe pick up on deficits in their education, suggest that they watch a specific topic that may help them.
Let's talk about how the patients and the families might access these channels. Now, from the hospital, you said it's channel
74 and 75.
And it will automatically come up when the patient first turns the TV on. Now, will that channel be, can you access it from the waiting areas too?
Yes, you can, June. I'm glad you brought that up, because it is going to be in each patient room and also the waiting areas in the hospital. And then we hope to extend this out to physicians' offices too. So if a patient there would like to watch a specific topic, especially in the OBGYN areas, or the surgical patients as well, they can watch it before they actually have their procedures or before they come to the hospital.
Now, I heard that it's also available at home.
Yes, it is.
And how might that work?
We give the patients a code before they actually go home, and if they do use their computer, they can go on the website, which is thepatientchannelnow.com or thenewbornchannelnow.com, and then they just plug in their code, which is 41299, and that's the same code for each channel.
For both the patient education channel as well as the newborn.
Yes.
It's the same code or the same login.
Yes.
And
and it walks you through that once you get to the channel site. Yes. It'll ask you for the code.
Well, I think that's a great a bonus, because once you get home, you're thinking, now, what did they say I need to do?
Absolutely.
And
you're given so much information, and this is just another way that we can reinforce what we have told the patient and their family, so that when they go home and they're in a calmer setting, they're not as nervous. They can call up any topic they want to watch, and then if they should have questions, they could always call back to their doctor's office, or a clarifying question, they could certainly call back up to the floor that they were on.
They could probably call their nursing station. And
absolutely. We'd be glad to answer any questions.
I think that's a real important piece. It would help you with understanding your diagnosis, understanding your what you're supposed to do at home, or
Right.
understand your medications. You know, you get home and you've gotten so much information, and it's just, it's hard. So I think that's going to be great for
I do
for our
too.
viewers. And
We're
for our
very
patients.
excited. We've been actually working on this for a
Quite a
couple
while.
of years now. When we first moved in, we didn't have the hookup for cable. So now that we do, we have, gone ahead and full steam ahead.
Great. Well, this has been great. It's such a wonderful resource for our patients, and I'm so happy that that's now available. And I'm especially happy that you were able to come and talk to us about this today. So
I am too. Thank you for having me, June.
you're welcome, and I look forward to your next visit because you always have something so exciting to tell me.
Thank you.
You're welcome.
I'll come back.
Okay, great.
Okay.